asking for perfect quiet. If everybody can get silent for us, we're asking for 2 minutes of silence for Anthony Lamar Smith. Please, moment of silence. Anthony's mother wants everyone to know it was not a mistake that Anthony Lamar Smith got murdered. It was a setup. It was the biggest conspiracy ever. Say Anthony Lamar Smith was the biggest conspiracy set up. You can put that all over your Twitter, Facebook, social media. Sorry I had to have you guys say that. Now we can start our moment of silence. If the person next to you is speaking, please ask them to respect the moment.
Y'all still in the back. Her down.
We have 1 minute left.
Hey, y'all share this shit, man. Get this shit out to the people. I don't give a damn. Put them in every Facebook group that you're in. I don't give a damn if you're in a sex group, religious group, arts and craft group. What's up, man? Y'all share this shit, man.
My church! My church!
About pre-existing conditions again. Well, here we are again, concerned what might happen as a result of this legislation and what a state might do to take away the protections of pre-existing conditions, because they waive it. They're allowed to waive it under these bills. Allowing states to impose burdensome work requirements is a condition of coverage. That's another result of the bill. Taking coverage away from millions of Americans. We mentioned that, but it bears repeating. This isn't just a policy debate. This is about folks that we all represent. I represent families in Pennsylvania, many of whom wrote to me, have contacted me, telling me their stories. One of them was Pam Simpson. She's from southeastern Pennsylvania, Coatesville. Her son, Rowan, was diagnosed on the autism spectrum a number of years ago. Prior to having the protection of Medicaid, what we call in Pennsylvania medical assistance, that family had a big challenge. Challenges continue even after coverage. But what Pam said to me in a letter was how much benefit there was to her family in terms of getting the treatment and the help from Medicaid. She said, and I'm quoting from her letter, "Without Medicaid, I'm confident I could not work full-time to support our family. We would be bankrupt, or my son," meaning Rowan, "would go without the therapies he sincerely needs." So there's a child, I think he was 5 years old when he was diagnosed. There's a mother telling me that their life is a lot better because they have the protection of Medicaid, because their son has a disability. And there are a lot of families that the child might have more than one disability. And even some families that have even wealth or really good health care coverage, they still need Medicaid if they've got a child with a profound disability. So this isn't just about one group of Americans. This cuts across all incomes, all regions, all parties, all beliefs. That's what Medicaid does. Because you know what Medicaid is? It's an American program. We're the greatest country in the world. We can have the strongest, and we do, economy in the world. We have the strongest military in the world. And we can do all that and still have a program that says to any family that has a loved one with a disability, we're going to help you. We don't care where you live. We're going to try to help you because your family member has a disability. Or if you're low income, we're going to make sure that your child has health care and gets all of the excellent screening and diagnoses that take place early in a child's life to prevent disease, to prevent all kinds of challenges in the life of that child. Because we're a great country. We're called America. That's what America does. We take care of people that need help. And if it costs some more, we find the money to do it. Just like we find the money when we have a conflict to protect our security. We all come together as a country, and we protect the country. Well, it's about time Washington came together to protect people that have the benefit of a great program called Medicaid or other health care programs, because that's what a great country does. If we do to Medicaid what some here have wanted to do, we will be diminished as a country. We will all be diminished. Do we want to live in a country where we just had 20 million people gain health care coverage and go backwards? Have more people without health insurance? Have more children lose their Medicaid coverage? Is that the country we want to be? I don't think so. I don't think any Republican believes that. I don't think any Democrat believes that. If you call yourself an American, because that's what America does. We take on big challenges and we solve problems. So Medicaid is not the problem here. We got problems in our healthcare system. Medicaid's not one of them. Medicaid is helping a lot of people, and we're going to protect it. This idea that we've come together in the Help Committee on fixing parts of the system we got to fix and do a thorough examination and have hearings, isn't that a radical idea? I know that I just heard in the last couple of hours, there's a health care hearing on Monday. Oh my goodness, isn't that wonderful? So there'll be a hearing on Monday, and I guess they want to pass the bill on Thursday. That's what counts for thorough examination or regular order of one of the most complicated challenges we have. Why don't they agree to do it like Lamar Alexander did as the chair of the Help Committee? He said, we're going to take these discrete individual challenges and examine them closely, come together on a bill, and then pass the bill. And then we're going to move to the next problem and the next challenge and solve them one at a time or two at a time. Not take a meat axe to Medicaid and hope it works out for people that don't have any health care coverage. That's what a great Senate would do. We would have months of hearings on this bill that some people want to pass by the end of September. But I'll go back to the positive plane that we've been on. Good work in the Help Committee on some issues. Good work in the Finance Committee on the Children's Health Insurance Program, getting it reauthorized. While all that collaboration is going on, all of those good discussions, all of that back and forth about policy, no yelling, no screaming, no finger pointing, all the while, just in the last couple of days, this bill is moving through Washington, quietly, but it's moving, and it's starting to pick up momentum. Like a snake in the grass, that's what this bill is. Like a snake in the grass. You may not see it yet, you may not know much about it, but it's coming. And if they pass it next week, you may not feel the impact in 2017. You may not feel the bite of that serpent in 2018. You may not feel it in 2019, but you're going to feel it. And if we allow that snake in the grass to inject its venom into people, my analogy for losing your health care coverage, then we're not the Senate we should be. We're not So please don't make the argument that Medicaid is going to be just fine. When you're block granting it, which is a rather benign description of giving a block of money to a state and hoping that it works out, hoping that it's enough money, enough funding to pay for that state's Medicaid needs. What if you have more children with disabilities? What if that number grows? This bill basically says to the state, good luck, state, which has to balance its budget, by the way. Federal government doesn't do that. The state has to balance their budget, and they, by definition, will have to cap services and treatment to people with disabilities. So that's what this is all about in the end, about sending the problem back to the states, calling it flexibility. Isn't that a nice word? All these benign words, flexibility, block granting, per capita caps, they all sound so benign. There's a lot of venom in those policies. What does it mean for one state? I'll just give you one example. In Pennsylvania, we had more than 700,000 people obtain health insurance through Medicaid expansion. Over 700,000 people. In the marketplace, the exchange was over another 400,000 people. So more than 1.1 million people got health care in one state through Medicaid expansion or through the marketplaces. How about rural Pennsylvania? We have 67 counties. How about the 48 rural counties in my state? How many of them, how many people living in rural Pennsylvania got health care? At last count, it was over 278,000 people, almost 280,000 people. 180 obtained health insurance through the Medicaid expansion, and the balance was through the exchanges. So what are we going to say to rural Pennsylvania? I know 180,000 of your neighbors and friends and family members got health insurance through the Medicaid expansion, but we're going to wind that down, and you'll be just fine. Don't worry, Washington will guarantee that you're just fine. That's a big lie if you try to make that argument to rural Pennsylvania and to other parts of our state as well. What do we say to rural hospitals who have very thin margins already, some of them on the brink of having a major problem, and depend upon the support they get from Medicaid? Because in rural Pennsylvania, we've got a lot of folks that have illnesses and challenges that maybe some of the rest of us don't have. And they tend to be older folks that have those challenges too. What do we say to them? We're saying to them that we're just going to wind down the support that Medicaid provides in a state like Pennsylvania. So my plea to my colleagues is, don't allow this snake in the grass to get close to anyone and to bite them and inject venom in them. Don't allow that to happen. Don't allow this bill to rip away health care from millions of people. Just like the bill before that and the bill before that. Work with people in both parties to do what we're doing in the Help Committee and to a certain extent, although very limited, in the Finance Committee. But I think we have a good model to work together. But I can't go back to Pam Simpson and say, Pam, you know what, I know you're happy with the Medicaid that Rowan is receiving, and I know it's working out for you, but you know there's some people in Washington that just had a different idea for you, so you're on your own. You and your family are on your own. I don't think that's what we do as Americans. Forget being senators. I don't think that's an American thing to do. We help people that need help. All of us in our lives need help at some point or another. No one is immune from some of these challenges. I'll just read two sentences from the end of the letter that Pam Simpson wrote me months and months ago, at the early part of this year, when she talked about how important Medicaid was to her. And she's pleading with me at the end of this letter to protect her son and protect her family. And I would just ask that my colleagues consider this when you're considering how to vote. Pam talked about all the benefits that Medicaid provides her son because of his disability and their family. She said, please think of Rowan, my son. Please think of, She says, please think of my husband and me. But then here's how she concludes. Please think of my 9-month-old daughter, Luna, Rowan's younger sister. Please think of my 9-month-old daughter, Luna, who smiles and laughs at her brother daily. She will have to care for Rowan later in her life after we are gone. Overall, we are desperately in need of Rowan's medical assistance, Medicaid, and would be devastated if we lost these benefits. I hope we can all say to Pam Simpson and her family, and any family that benefits from Medicaid or Medicaid expansion or the protections of the Affordable Care Act, we're guaranteeing that you're going to have those protections. We're going to guarantee that those protections are going to be there for you. I hope that every member of the United States Senate can say that and vote in accordance with that promise. And I would, to use an old expression, ask members of the Senate to examine your conscience. Is this what you want people to remember you for, this kind of a vote? Where Rowan's mother has to worry, or Rowan has to lose his Medicaid coverage, or a poor child in a big city has to lose their health care coverage, or a child in a rural area, or someone working at a rural hospital loses their job because of these massive ideologically driven cuts to Medicaid? I hope you can answer the call of your own conscience when you vote that way. Mr. President, I would yield the floor.
Mr. President.
Senator from Hawaii.
Thank you, Mr. President. For the past several months, Republicans in Washington have done just about everything they can to hide their health care repeal bill. Remember, way back in the beginning, they tried to actually move a bill without a CBO score. And then they realized even Republicans didn't want to vote on something without knowing how much it would cost or how many people would lose health care coverage, so that they said that the score doesn't matter or that it's wrong, except for in the areas that they like the numbers. They trashed the CBO, even though for the last 8 years they referred to the CBO to make their arguments against the Affordable Care Act. But when that didn't work, they tapped 13 men to draft a bill in secret. And no surprise, a bill crafted without women, without hearings, and without Democrats was not able to cross the finish line. So now they're actually back to their original plan, which is to push legislation without a score from the CBO. In other words, we're going to go to next week and we're going to vote without knowing how bad this bill is. This is not the way the Senate is supposed to work. If there is no score, there should be no vote. Now, clearly, CBO got back to the Senate today and said that they will have enough time to analyze the fiscal impact of this proposal, but they will not be able to analyze the impact it has on our constituents. And so remember the last 2 or 3 iterations of this bill, people were concerned with the fiscal impact, but remember the headlines were 18 million people lose coverage, 26 million people lose coverage, 32 million people lose coverage. We're going to vote next week not knowing how many people are going to lose coverage. Now, it shouldn't matter what side of the aisle that you sit on. We should all be able to agree that something as complicated as health care needs as much debate as we can possibly get. And that's certainly more than the 90 seconds that procedurally we have left on this bill. After all, this is 1/6 of the American economy, but for the 3rd time this year, Republicans are going to do whatever it takes to pass a health care bill, even if no one knows what's in it or what it will do, even if this bill is very clearly bad policy. And by doing this, they are letting down millions of Americans who were counting on the Senate to be the cooling saucer, to slow down and consider policy carefully. But there has been very little debate around this bill. We have not heard from doctors. We have not heard from patients or advocacy groups. We have not heard from healthcare administrators or economists, and that's because we've had no hearings. Now, just tonight, Senate Finance Chairman Hatch announced that on Monday at 10 a.m. his committee will hold a hearing on the bill, and I'm hopeful that through that process we will at least begin to understand the damage that this bill will do. But right now, here's what we know. This is actually the most extreme of all of the versions of trumpcare that we've seen. And here's what it does. It eliminates everything in the ACA that was essential. Tax credits and subsidies to help people to afford their insurance. The Medicaid expansion, which is very, very successful and very, very popular. And the protections that we have in place for people with pre-existing conditions. It eliminates Medicaid as we know it. This bill eliminates Medicaid as we know it. So what they did was they established block grants, which means you get a fixed amount. Each state gets a fixed amount for Medicaid. And then those Medicaid block grants disappear after 10 years. It is shocking to me that having failed to get the votes, they went further to the right with deeper cuts to Medicaid, both the Medicaid expansion program and the Medicaid program as it existed before the Affordable Care Act. And they went ahead and said, you know, we only got to 49 votes last time, so I think what we should do is eliminate all of the subsidies, all of the patient protections, all of the essential health benefits, and all of the Medicaid expansion, and let's take Medicaid as it exists and eviscerate it. The latest version of trumpcare will take health coverage away from tens of millions of people. Last week, our country hit an important milestone. The number of Americans who do not have health insurance fell to a historic low of 8.8%. That means 9 out of 10 Americans now have health insurance. But instead of celebrating this milestone, Republicans are about to end our country's progress on health care. Americans who don't lose their coverage will still get hurt with higher premiums or insurance plans that don't cover basic things like getting help for opioid addiction, pregnancy, hospital stays, mental health. So if this bill passes, health care will no longer be a right in this country. It will be a privilege that depends on where you live, where you work, and how much money you make. This bill devastates one of the best and most successful programs that this country has, and that's Medicaid. This is a program that helps 1 out of every 5 Americans and 2 out of every 5 children. It helps 1 out of every 2 families with a newborn baby, and it covers 3 out of every 4 long-term nursing home residents. Medicaid saves lives. Nursing home patients, people struggling with opioid addiction, people who are working 2 jobs but still don't have enough to cover their own health care. But this bill destroys Medicaid as we know it. They start off by putting traditional Medicaid into what they call per capita caps or block grants. That basically means whatever money was spent last year, that's the amount that a state gets in perpetuity until they just zero it out completely. And what that means is that states will be left without adequate federal funding for Medicaid. Think about what this means for the healthcare infrastructure in this country. In many states, hospitals and local governments have actually designed a healthcare system based on a certain amount of federal funding coming in. If you take away that funding, hospitals will collapse. In rural areas, hospitals and clinics will close, and people will be left without options and ultimately without access. And that's just the damage done by cutting Medicaid. This bill also lets insurance companies opt out of covering what they call essential health benefits. This is a term of art, it's a piece of jargon, so I want to explain what this means. Under current law, there are certain things that have to be in any healthcare plan. Those are called essential health benefits. So you buy a healthcare plan wherever you buy it. If you get it employer covered, if it's a DOD plan, if it's a VA plan, if you're on the exchange, whatever it is, it has to cover certain things. And let me list what is covered right now as an essential health benefit. Ambulatory patient services, emergency services, hospitalization is covered, maternity and newborn care, mental health and substance abuse services, prescription drugs, rehab, lab services, preventative and wellness services, chronic disease management, and pediatric services. So these are the things that actually have to be in your health care plan under ACA. And you know what this bill does? It says, no need. Configure your health care plan however you see fit. And if you're a health insurance company, and if you're a for-profit health insurance company, you're going to pick and choose these things based on what's profitable. And if there is a certain thing that is costing you a lot of money, you are under no obligation to provide any of these health benefits because it's not in the law anymore. This eviscerates essential health benefits. This bill will also take away protections for people with pre-existing conditions. Nothing will hold states back from allowing insurers to charge people with diabetes more, with cancer more, for their health insurance. Experts have started to look at what this will mean for people with pre-existing conditions, and they will pay thousands of dollars more. A patient with asthma will pay more than $4,000 a year extra if this bill passes, while a patient with metastatic cancer will pay $142,000 extra. You've got metastatic cancer, this bill costs you $142,000. You've got a kid with asthma, that's $4,000 a year. This is their health care bill. To charge people who get sick more. That's their health care bill. Everything that is working under our health care system is being shredded by this bill. Take Planned Parenthood. These health centers serve millions of women and men across the country. They're part of the solution, not the problem. But this bill cuts funding to Planned Parenthood, which will cause many of these clinics to close. And I want you to think about how many people in this country are actually employed in the healthcare industry. When the Affordable Care Act started to kick in, research estimates that as many as half a million jobs were created. But if millions of people lose their insurance, that means they will lose access. If fewer people can access health care, that means we will have fewer doctors, nurses, and technicians. In other words, cuts to health care coverage are also cuts to American jobs. And I know that in a lot of rural communities across Hawaii and across West Virginia, across the country, the community health care center or the small rural hospital is not just the center of the community in a social context, in a community context, but a lot of times it's the economic driver. And so this will do great damage to rural America. I want to end by making clear what this means for Americans and their health care. This is bad policy, plain and simple. It's bad if you live in a state like Ohio where lives have literally been changed because people now have access to prescription bad for people with disabilities. And this is not unusual. For whatever reason, people with disabilities are the first to be punished when the battle over health care comes up. It's bad for people with pre-existing conditions because states will no longer be required to protect your ability to get health care. This bill does not pass Senator Cassidy's own Jimmy Kimmel test. That's why more than 500,000 doctors in the United States have come out opposed to this bill, because it will take health care away from our conscience. As senators, forget Democrats and Republicans, forget liberals and conservatives, we are all here because we want to try to make a difference. And so there we were with Lamar Alexander, the chairman of the Health, Education, Labor, and Pensions Committee, and Patty Murray, the top Democrat on that committee, and they were ready to work on a bipartisan basis. Lamar held hearings, and by all accounts, tough negotiation, difficult challenges, not as much progress as you want, as quick as you want. That's the way legislating works. But they're in a bipartisan process, and we show up here, and that process is in danger of being blown up. And all for this bill, which is a rotten piece of legislation. It's not like this thing has been vetted by experts. It's not like this thing is bipartisan. It's not like this thing will help. It would be one thing if this were absolutely necessary. And then you can make some procedural accommodations because you just must. This is a political necessity for a party that has not yet had a legislative win. That's why they're doing this. They are in a hurry because they have until September 30th to check a box called "We repealed and replaced the Affordable Care Act." They have no new ideas, so what they did was they took all of the bad ideas from all of their previous bills and put it into one bill. And they're going to take one last swing at it. I cannot tell you how disappointed I am, not just on policy, but on process. I was never prouder to be in the United States Senate than that early morning after a long session when John came in and, in my view, saved the Senate and put us on a path towards regular order. Do not blow that up. We have a chance to do things in a bipartisan way to restore the dignity of this institution, but what we are fixing to do next week will take us in a very, very dark direction. I yield the floor.
Madam President.
Senator from Connecticut.
The gentleman, before he leaves the floor, I just want to probe the gentleman for a moment on this question of process, because, listen, this is an affront to the United States Senate, a bill that reorders 1/5 of the U.S. economy being delivered to us days or weeks before we're to vote on it. But you may have covered this, and if you did, just reiterate it for me. My understanding is there is not going to be a CBO score before this bill is before us. And for folks that don't know what that means that everyone who votes on this bill will have no clue how many people lose insurance, how high premiums are going, how much money their state will lose. I don't think we have ever voted on a bill of this scope and size without an analysis from CBO. And my understanding is today that when you list or rank the affronts on the process involved in the debate over Graham Cassidy, at the top of that list is the fact that we aren't going to see a CBO score.
That's right. And well, I would just say thank the senator from Connecticut through the chair, and just point out that they're going to get the fiscal impact from CBO in order to comply with the terms of reconciliation. But that's actually not what impacts the American people the most. When you get a CBO score, and it's exactly right what the senator from Connecticut said, is you find out what impact it has on your home state. You find out the number of Americans that are going to be harmed by this bill or helped by this bill. And what we do know is that this basically contains elements of all of the previous pieces of legislation. It actually just kind of combines them all and puts them in a pile. So it's very hard for me to imagine that when they do come back with their analysis, that it won't be 20, 30, 35 million people having lost health care. And the craziest thing about this is that they will find, these Republicans who will vote yes are going to vote yes and then find out 10 days later that 25 million people are going to lose their health care. And why they won't wait is beyond me, except that they have a deadline to deliver a win for the president. And that's, as near as I can tell, the only reason that they're in such a rush.
And we're in a different position today, if I can ask you a follow-up question, because when we were taking these votes a month ago, there was only faint talk of a bipartisan process to try to keep what works in the Affordable Care Act and fix what isn't working as well. And another assault on the process, in my mind, and I ask for your thoughts on it, is that literally, as we speak, Republicans and Democrats are talking to each other about the bipartisan bill that Americans in every state are begging for. And apparently, if this bill is going to be brought before the Senate, that whole process was a fraud. It was a ruse to distract Democrats into thinking that there might be a bipartisan fix, into pulling one over the American public as to give the impression that maybe Republicans were interested in bipartisan compromise. Right now, there's a process playing out, right? And if this bill comes up for debate with no CBO score, then that bipartisan process, which was really hopeful for a lot of Americans, I assume it just falls apart, right?
I think you're right. Through the chair, I agree with you. I think that one of the most encouraging things over the last 5 weeks is Lamar Alexander and Patty Murray and their ability to work together. I mean, If you had told, I think, either of us that we were going to repeal and replace No Child Left Behind with 70-something, 77 votes in the United States Senate, I would have said, I don't know, that seems like it's going to get into some pretty difficult, partisan, thorny territory. But what Lamar and Patty were able to do is conduct hearings and bring us through a process where we acted like a Senate and we got all the votes. And now we're in that process when it comes to health care. And I think some people feel deeply uncomfortable with empowering the chairmen and women of this body, and they feel deeply uncomfortable. They talk about the regular order, but they really won't just want to get their way on the floor. I'll just make one other point here, because as people on the Republican side were justifying their yes vote in BICRA and whatever the other one was called before that, they were always talking about advancing the conversation and bringing us into a conference committee negotiation. Now, because September 30th is the deadline, there will be no negotiation. Graham Cassidy passes the Senate, it will pass the House, it will be enacted into law. So nobody gets to hide behind, well, this isn't perfect, but I want to advance the conversation, and maybe we can fix this in the House or fix this in the conference committee. This is the bill. The bill that gets voted on next week is the bill, and everybody owns it. And you also own the fact that you don't even know what it's going to do to your own constituents.
You don't know what's going to do to your own constituents. I thank the gentleman. I know it's late, and I thank him for staying on the floor for a few moments. You don't know what's going to do to your constituents. We don't have a CBO score telling us how many people lose coverage, how high rates go, what happens to Medicaid. But it's also another bill that's been written behind closed doors. So Senator Cassidy and Senator Graham may have spent some time thinking about what this legislation does, but virtually no one else has been let into the room. Patients haven't been in that room. Doctors haven't been in that room. Hospitals have not been in that room. And you know why I'm pretty confident of that? Because all of the groups representing those populations oppose this legislation. We're going to potentially vote next week on a health care bill massively reordering the American health care system that is opposed by the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Physicians, the American Congress of Obstetricians and Gynecologists, the American Osteopathic Association, the American Psychiatric Association. Those are the physician groups. And by the way, it's kind of hard to know for these groups whether they're for it or against it because there's no CBO analysis of this. But the patient groups have weighed in. Basically, every group representing patients who are sick in this country are begging this Congress to not pass this bill. The ALS Association, the Cancer Society, the American Diabetes Association, the Heart Association, the Lung Association, the Arthritis Foundation, the Cystic Fibrosis Foundation, the Juvenile Diabetes Research Fund, the Lutheran Services of America, the March of Dimes, the National Health Council, the National Multiple Sclerosis Society, the National Organization of Rare Diseases. I mean, how do you pass a bill that has no CBO score, that has had no hearings, that's opposed by every single group that Republicans welcome into their office every year, representing people with serious diseases? There have been some really mean health care proposals. But Graham Cassidy is the meanest version of trumpcare yet. And let me walk you through why I say that. Again, we don't have the numbers here. So we don't have a CBO analysis of how many million people are going to lose access to health care. But let me guarantee you, it will be in the millions, likely in the tens of millions. The bill radically trims the amount of money that states will get in order to insure the population that has been insured by the Affordable Care Act. What this bill does is shrink the amount of money that we're spending, then redistribute it out to states, And it will simply not be enough, not nearly enough money, in order to cover the 20 million people who have insurance today because of the Affordable Care Act, many of those through Medicaid, others through the healthcare exchanges. An early analysis by an outside group who's trying to help us understand what this means suggests that for my little state of Connecticut, it will be a $4 billion reduction in healthcare dollars from the federal government to the state of Connecticut. Now, we're a state that doesn't have a $20 billion annual budget. $4 billion means that we will either have to kick hundreds of thousands of people off of health care, or we will have to dramatically raise people's taxes. So all of the reductions in insurance are in this bill. You will just have millions of people losing access to health care insurance under this bill. The specific targeted harm to women is in this bill. Planned Parenthood is one of the country's biggest providers of primary care and preventative health care services to women. I get that many Republicans have a problem with Planned Parenthood because they also provide abortion services, but the majority of their work is, in fact, providing basic preventative health care to women in this country. My wife, when she was a low-income 20-something, could only afford to get her health care through Planned Parenthood. That's where she went for her preventative health care, for her wellness checkups, and there are millions of women just like her. This bill is particularly cruel and particularly mean to all of the women in this country who, without access to a Planned Parenthood clinic, may not be able to get quality, affordable, preventative health care. This bill is perhaps the meanest, though, to individuals who are sick or individuals who have been sick. Because at least in prior versions of trumpcare that came before this body, there was at least a meager attempt to try to preserve protections for people with pre-existing conditions. It wasn't workable, but at least there was a face-saving gesture by Republicans and by the Trump administration to try to at least claim that there was language to protect people with pre-existing conditions. Senator Cruz sat on this floor a few years ago during his long overnight filibuster. I sat in the chair listening to him explain how everyone knows, including him, that you cannot protect people with pre-existing conditions without requiring in some way, shape, or form that healthy people buy coverage. Why is that? Let me walk you through it for a minute, because it's not hard to understand, but it's really important to understand, because people don't like the individual mandate, and I can understand that. Nobody likes to be required to do something, but you cannot protect people with pre-existing conditions if you don't require healthy people to buy insurance. And the logic goes like this. If you say to insurance companies that you cannot charge people who are sick more than people who are not sick, if you say to an insurance company that you cannot charge someone with cancer more than someone who is healthy, and you don't require that healthy people buy insurance, then what does the rational individual do? The rational individual in that case says, why would I buy health insurance? Well, I am healthy. If I won't be charged anything more for it when I become sick, then there is no rational economic reason for me to be covered when I am healthy. So, what insurance companies tell you, what every insurance expert tells you, is that if you require insurance companies to charge the same between sick people and healthy people, then healthy people won't buy insurance. And if I was advising someone, I'm not sure I would tell them to buy insurance if they didn't have to until they were sick. And the pools get so skewed with sick people and no healthy people that rates dramatically rise for everyone. Some estimates suggest that the rate increases would be 20% per year, compounding year after year after year. And so, in the last version of this bill, Republicans knew that, and so they included a version of the individual mandate in their bill. Now, it wasn't the same mandate, but it was a mandate nonetheless. The mandate under the Affordable Care Act says that if you don't buy insurance, you'll pay a fee on your taxes. What the Republican bill said, the version of trumpcare that came very close to getting a vote on this floor, it said that if you go without insurance, you'll pay a penalty when you try to get back on it. The timing of the penalty was just different. Under the Affordable Care Act, you pay it when you lose insurance. Under the first version of trumpcare, you would pay the penalty when you try to get back on insurance. It's a mandate. It's a penalty. It's just in a different place. And Republicans did that because they knew that that was the only way to require states or give states the option to continue to require insurance companies to treat sick people the same as healthy people. Okay, so why am I talking about this? Because in Graham-Cassidy, the individual mandate is totally gone. Gone. Replaced with nothing. Thus, even though it says that states, if they wanted to, could preserve protections for people with pre-existing conditions, states cannot do that because the federal government does not require healthy people to have insurance. And if you think that states are going to reimpose an individual mandate, A, there will be some real question as to whether they can do that, and B, they won't. They won't, because that issue has become, thanks to my Republican friends, so politically toxic around the country. And so you will be left with massive discriminatory treatment of people with pre-existing conditions. And nowhere for them to go. Because Medicaid is obliterated under this bill. Medicaid dollars get lumped into all the rest of the money, get sent down to states, and then Medicaid dollars are capped going forward. Intentionally capped at a number that is well below what the general rate of increase in the Medicaid program is. There's intentionality to the underfunding of Medicaid here. Now, the old bill would have taken, I think, 15 million people off of the rolls of Medicaid. I think I'm getting that number right. And, well, we'll never know what this number is before the vote happens. It's likely around the same number, because this bill treats Medicaid in roughly the same way in terms of capping the amount of money that states get. The formula by which states get this money is so wildly complicated that no one could understand it between now and next week. I would challenge any Republican other than Bill Cassidy and Lindsey Graham to come down here and give us an explanation as to how this formula works. It is the most bizarre Rube Goldberg scheme that you could ever imagine. But in it is an overtime dramatic reduction in Medicaid payments to the state. So think about this little boy, Deacon. Deacon is 10 years old, and he lives in Ohio, and I'm just looking here at a picture of him clutching a Pokemon character. I know which Pokemon character this is. It's Pikachu. I know that because I have a 9-year-old who's the same age as Deacon. But for the grace of God, my 9-year-old is not going through what Deacon, the 10-year-old, is going through. I'm just going to read you a little bit about Deacon. He loves playing baseball, playing video games, volunteering at animal shelters. He loves being a patient champion for children's hospitals, spending time with his friends and family, being a big brother, raising money and awareness for heart disease and defects. Now, my 9-year-old doesn't enjoy raising awareness for heart disease and defects. The reason that Deacon enjoys doing that is because he has a condition called hypoplastic left heart syndrome that's combined with asthma and acid reflux. It essentially means that Deacon has half a heart. We have whole hearts. Deacon has half a heart. Right now, everything is controlled for Deacon by medications. He's had 6 heart surgeries to get to the point of stability. His heart will fail, not may fail. His heart will fail. He will go into heart failure, requiring a heart transplant. That is Deacon's future. A heart cannot last on the 2-chamber system that Deacon surgeons put into place. Affordable quality insurance means everything to Deacon. Strep throat could be a death sentence for him. Any little virus that gets into him and goes into his bloodstream, that's it. Game over for 10-year-old Deacon. His parent writes, "My child is alive because he has Medicaid." That allowed for him to have the doctors, the surgeons, and the care he has always needed. Deacon had 6 heart surgeries before 3 years of age. He has continued medications since, as well as regular doctor's checkups, he needs them. Because of his diagnosis, he even has a specialist for simple things like dental care. If he had not had Medicaid coverage, there's no way I could have afforded his care. By his first surgery at 10 days, he was over the $1 million mark. I would have lost our house easily, quickly. I'm a single mom. Medicaid helps keep my son alive and healthy. And it's given me my best friend to love and watch grow up. Medicaid helps a boy live a normal life where we would have never thought that it would be possible. Medicaid lets a boy with half a heart be on a baseball team with his friends. Her best friend. This isn't hyperbole. This isn't a game. It's not about scoring political points. Just because you made a promise